Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirley North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 and 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health. Hi, everybody, and thank you for joining me today. I'm Dr. Shirley North from North Star Physical Therapy, and this episode is going to be talking all about the importance of pelvic floor physical therapy for pre and post prostatectomies. So first of all, for all those that have a natal penis or natal prostate, for those that identify as male, this is all for you. When you have that organ, there is a likelihood that that organ with age may not be operating optimally, may not be functioning as best as we want it to be, whether that is for reproductive reasons or just for overall self-health. And so I just want to stress the importance that every pelvis deserves optimal health, optimal care, and pelvic floor physical therapy. So pelvic floor physical therapy isn't just for those that are postpartum and have a vagina, okay? Pelvic floor physical therapy is also for those that have any kind of pelvic surgery, prostatectomy being one of them. The prostate is directly within the pelvis. It is the structure that actually surrounds the urethra between the bladder and the outside. And so when that prostate gets inflamed, when that prostate enlarges, it can affect how urine is able to flow through the urethra to the outside world. And also there are screening tools like the PSA factor to be looked at through blood work, especially for those over the age of 40, or for those that have a family history, especially someone that's immediately related to you, like a father figure or brother or something like that, that have been diagnosed with maybe prostate cancer or a large prostate. We want to make sure that these screening tools are happening for men or for those that have this organ, and because it needs to operate functionally and optimally. And so when you are having those signs and symptoms within your urinary function of maybe your flow hesitates before it starts going, or maybe it's a bit sporadic, or you don't feel like you can fully empty, or if it's painful, is there maybe an infection going on? Or do you have pelvic pressure or pelvic pain when you're trying to urinate, or maybe after urination or right before? All of those things you should be able to see your urologist and get the workup done with blood work, as well as a potential ultrasound, and potentially, and probably most probably, a examination of the tissues, and that is through a rectal insertion. That is one of the best ways to really be able to palpate the prostate. Now, that palpation can bring on some other physical signs like an erection, or it can be very painful, right? So it is very, very important for those that have a prostate to make sure that organ is being checked upon on an annual basis, and especially if there's a family history. Now, where we fall into the pelvic floor physical therapy is if you're starting to have those signs and symptoms of, for us to be able to help out with, is it your prostate, or is it maybe the position when you're if you stand to pee, when you're standing, or when you're sitting. The pelvis position can help with opening up that area. For those with a penis, it is also the angle of the penis, of that urethra, and for the flow to occur optimally. Also, we take a look at the pelvic floor muscles. Are the muscles really constricting down in that area, making it difficult to pass the urine through the urethra? There are several factors. We also look into hydration. We look into any kind of maybe bladder irritant that's going on. So we kind of take a step back and look at the whole picture of the pelvis itself. We do rectal examinations where we can palpate the pelvic floor musculature at this level. We can also do external pelvic examination for the external musculature that is more towards the front of the pelvis area, and to see if that is contributing to anything. We also look at the hips and the low back and the bigger picture to see, again, if the alignment or the positioning or maybe some muscle imbalance or some fascial tightness, things like that can give rise to these urinary symptoms. But let's say it has been diagnosed with prostate cancer or with hypertrophy, and you're taking out the prostate either partially or all the way. There are things to be able to look for post-operatively, but I think a lot of people forget the pre-op importance. We do prehab, right? We want to do all these positioning education things. We want to rule out any orthopedic limitations that may give rise to some difficulty post-op. And so it is very important that if you were scheduled for a prostatectomy, that you go see a pelvic floor physical therapist, or at least consult one for these educational things and for potentially screening out some orthopedic contributions so that your post-op recovery is optimal. Now, there are some clients of mine that get a prostatectomy, did not see a pelvic floor physical therapist prior to, and here they are months, if not years later, still having urinary issues. And this is where I wish we could have seen you before, but you know what? It's never too late to work on it. So it is very important, just like any surgery, to prepare your body for the surgery and then have immediate post-operative care afterwards so that the function can get back as optimal as possible. So in this case, your urinary functioning. Oftentimes, urinary and bowel functioning and sexual dysfunction can occur hand in hand with this. And so we really want to make sure that we're capturing the whole person. So unfortunately, a lot of the urologists out there don't really know the importance of pelvic floor physical therapy. So all more reason for me to broadcast it with my podcast here is to have clients be their best advocate, to know and to research, get out there, listen to these podcasts. Yes, Google things for yourself with the understanding that the physician and the healthcare providers can adapt that information to your situation. But it is incredible the amount of people that say, my urologist never recommended pelvic floor physical therapy. I wish I would have known this before. So let's get the word out there, guys, that if you have, again, a scheduled prostatectomy, whether for whatever reason it may be for, but we want to make sure we're having at least one session prior to surgery for educational purposes and potentially even in person to do an orthopedic screen for any muscle imbalance as of now. So that way, the post-operative, I normally see folks about 4 weeks post-prostatectomy. By that point, the catheter should have been removed. By that point, urinary function may not be coming back 100% anywhere from 6 months to 2 years after prostatectomy. So can you see that so many compensations and so much frustration can occur within that time? But if someone sees a pelvic floor physical therapist, we can work on that stuff right away so that by that 6-month mark, you're back and you're doing just great. So we really want to broadcast out there that prostatectomies also require a pre and post-op pelvic floor physical therapy workup and treatment, if nothing else, for education and for what to expect before surgery and after surgery. Not just on the organ level, but also on your urinary function, on how well you're walking, what your positioning like for standing versus sitting, how we breathe and pressure management for those bowel movements, how about sexual functioning and blood flow to that area, what about any kind of fascial tissue constriction or muscle constriction, how your stress levels are for preparing for surgery and post-op. Because your nervous system can hypersensitize the tissues down there just because of the stress leading up to surgery or for the unknown afterwards. So we want to capture all of those things, and a pelvic floor physical therapist is the expert in those areas. We do work in collaboration with the urologist and with the surgeon to make sure that everything medically is doing okay, and then we can be the second pair of eyes and ears on the healing process of that prostatectomy. And so if anything starts to act and feel funny, well, then we want to make sure the urologist and the surgeon is, with the information right away, so they can be well medically managed as well. So with all that being said, I hope this helps you guys see that pre and post prostatectomy pelvic floor physical therapy care should be a gold standard of practice, so that you going through that kind of procedure doesn't weigh so heavily on you emotionally, mentally, and then as well as physically, for your urinary function, for your bowel function, for your sexual function, and just your overall pelvic health. Thank you so much for listening, guys, and until next time.
Thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirley North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much, and thank you for letting North Star Physical Therapy be your guiding light to your optimal health.